Hey y'all, what's up? This is Aaron LeBauer with LeBauer Consulting, LeBauer Physical Therapy, and the CashPT Lunch Hour. And I'm super excited to have you guys here and join us today. This is Dr Nielsen, Dr. Dr Nielsen. He is my employee and CashPT resident, and we're going to be talking to him today about what he's been doing in the last year, or really even the last 5 months that he's been working here. While we're waiting for everyone to join us, go ahead and type in the chat where you're calling in from and if you can hear and see us okay. And just let us know that you're here, you can see us. And, sometimes we get people calling in from all over the world. We've had North Pole. We've had people from Africa, Asia, Europe, London, etc., and all over the United States, even down the road in Greensboro. So let us know where you're calling in from, and there should be a little chat box down to the right, and we'll get started in just a few minutes. What I want to do is give everyone a chance to get into the room, and then I'll introduce Dr. Nielsen. We'll talk a little bit more about what we've been doing, and at the very end, we'll have time for a Q&A. So go ahead and be sure to just kind of close down any other programs you have running in the background. If you have someone else playing Xbox or something using your internet, you want to make sure that all your internet resources are available for the broadcast so that you don't have an interrupted signal. If something does happen and you lose the volume or audio, well, volume and audio are the same. If you lose the volume or the video, just go ahead and refresh your browser window and that'll bring you right back in. All right, what's up, Alina from Dallas? How's it going? All right, if you guys are just getting in, you're in the right place. This is the CashPT Lunch Hour. And I'm here with Dr. Nielsen, and we're going to be talking about the CashPT Residency. And go ahead and write in the chat box where you're calling in from, and if you can hear us and see us okay. And we'll be getting started in just a moment.
I'm hoping I have some classmates show up.
Yeah, I hope so too. Then we got Edwin from Texas. Awesome. So Texas is in the house today. All right, we'll be getting started in just a moment. Let's give everyone a few more minutes before we get rolling. Go ahead and, if you want to get out a pen and paper, get it out so you can take down some notes. I'll also send you a replay of the webinar, and you'll get access to any resources we talk about when we publish it onto the blog and podcast. Hey, Eric, what's up, man? How's it going? Appleton, Wisconsin. I used to race bikes up in that neighborhood at Super Week out in Milwaukee. I did a lot of racing around there. All right. So if you're just getting here, this is the CashPT Lunch Hour. We'll be starting in just a moment. I'm really excited to have you join us today, and get ready because we're going to be talking about not only cash-based physical therapy, but basically a new person's perspective on what it's like to work in a cash practice right out of school. So this is going to be really awesome. All right, if you're just getting here, let us know that you're here and you can hear us. Hey, Michelle, how's it going? All right. Y'all ready? If you're ready to get started, type a yes into the chat box and we'll get rolling. Oh, I like to do that. I mean, was that inevitable or what?
Right on cue.
Yeah. Y'all didn't see that. I spilled my water. But that's okay. There's no computer or anything important around here. Let's make sure we're good there. Who needs water anyways? All right, y'all ready? All right, let's do this. Hello, my name is Dr. Aaron LeBauer with LeBauer Physical Therapy, LeBauer Consulting, and this is the CashPT Lunch Hour. Today, we're talking with Dr. Dr Nielsen about cash-based physical therapy and the CashPT Residency and his experience learning about cash-based physical therapy, marketing direct to patients, even his clinical experience and clinical mentorship here. So this is Dr. Nielsen. He's sitting right next to me. And this is one of the few times I have the opportunity to interview someone in person. It's actually kind of rare and really exciting, and here at our practice. So Derek, just will you introduce yourself, tell everyone a little bit about you, and even just go back to why you became a PT.
Okay. So I'm actually from Utah, Salt Lake City, grew up there, and then went to undergrad at University of Utah, exercise and sports science major, and then ended up moving out to Philadelphia. For grad school, I went to Drexel University out there, and then immediately when I got finished there, I moved here. I am an identical twin brother. Like, I don't know exactly what you want, how far you want to go
That's a
here.
good one.
But I got started in physical therapy because I had a friend that her brother ended up getting in a car accident, motorcycle accident. He flipped over backwards and got a traumatic brain injury. And her parents always said that the doctor saved his life, but the physical therapist gave him his life back. And I've always enjoyed exercise and being physically active. So that kind of, I was like trying to figure out, I was in undergrad trying to figure out what I wanted to do. I was like, that sounds awesome. I think we'll go for that. And then ever since then, just went to PT.
After undergrad, were you working somewhere else before PT school?
No, I took, so I'm a little bit older, I'm 32. I took 5 years off between high school and college.
Uh-huh.
And then I went straight through. Ended up taking the first summer off of undergrad, and I was like, well, that was a waste of time. I should have just kept going. And so I just went straight through from undergrad into grad school.
All right. What'd you do between high school and college? Ski?
I worked.
What'd you do?
Most of the years I served tables.
Uh-huh.
But there was, there's a span in time where I had like 5 jobs in 2 months.
Yeah.
Where I couldn't find anything I liked.
Yeah.
And then I was like, I gotta do something else.
What was it about those jobs you hated?
A lot of them were like physical labor.
Yeah.
And I didn't want to grow old too fast.
Right. What inspired you to get back to school?
My girlfriend at the time, her parents were pretty successful. They both were college educated. Yeah. My parents aren't college educated, so it wasn't like my family ever pushed me to go back to school.
Yeah.
But I looked around in my surroundings and saw the people that I kind of admired had gone to school. So,
yeah.
All right, I got to do something here.
Yeah.
I went back.
Right on. Wow. So did you get loans for school or pay your way through, or how'd that work out?
Yeah, let's not talk about that.
Yeah. Okay.
That's what I did.
Okay.
Yep.
Yeah. I know it's like stuff like it's like when I went to school, it was just like it was expected that I did it and it was provided for me. Yeah. And I took it for granted. I didn't take it for granted that I failed out, but when Andrea went back to school, she was like, I'm paying for this. I'm doing it. And she was like, yeah, why am I wasting my time on spring break? Why are teachers wasting my time? Like telling me a bunch of BS, and so it's a very different, I went back to PT school as an adult and it was very different than when I was an undergrad.
Yeah.
Did you have that? Did you see that in yourself?
Yeah. Grad school is more about go.
Yeah.
It was like the longest break I think I had through the 2.5 years was like 3 weeks over.
Okay. Yeah. So you got out of grad school, you saw, someone in your life had been impacted by physical therapy and you're like, okay, I like to work out. I like to be active. Yeah. Let's go down that road.
Yeah.
Did you, anytime during PT school, you're like, this isn't for me? Or was the whole thing like, yeah, this is everything that I've wanted?
No, I would never say that I didn't think this was for me. I just thought there were certain populations that I knew that wasn't for me.
Yeah.
So, for instance, like neuro patients or inpatient or acute care, I never thought PT's not for me. I thought that just solidified like that's the population I don't want to work with.
Yeah. Yeah. So, I was lucky. I didn't have to do assisted living in PT school. I got out of doing that. I was just like, it wasn't my population. Yeah. And I have friends who were like, boom, that was their population, So PT school's going on and you're in there, you're plugging away, you're doing your thing, you're studying hard. How did you, was there something that was going on? You're like, all right, I've had this experience and I don't like the way that works. I'm more interested in cash-based physical therapy, or more interested in learning something that I'm not getting. Like, where was that point at which you're like, okay, what I'm learning through the school isn't enough. I need to go learn something more.
Well, I always knew that I wanted to work for myself. I don't know if it wasn't necessarily cash based anything, but I always knew that I wanted to work for myself and have some sort of business. So I started researching that, like, what can I do? What is it going to take for me to work for myself? It wasn't okay. I don't want to work for insurance. That never came up in my mind. It wasn't insurance versus out of network versus cash versus anything like that. It was like, what is the best route for me to be able to work for myself? And so the more research I did and looking at that, and to be honest with you, I don't know exactly how it ended up working out, like how I found cash base and this, and it wasn't like somebody introduced it to me.
Yeah.
It was through the internet somehow. And then I started, your name came popping up, Chad Madden, those are Jared Carter. Those are the three names that I think those are the first three names that popped up. And then I just started researching it and seeing kind of what it was all about. And then got into thinking that's what I wanted to do. Yeah.
And then you found me or contacted me from Greg. So you got into Greg's program at some point?
Yeah. So I got into Greg Todd's program just because I knew that the whole marketing, in order to run any sort of business, you need to learn how to market through social media.
Yeah.
So I ended up getting into his program, been following his stuff for a while. And then what I really did is I was with Jeff Moore's group as well. And I reached out to Jeff. I reached out to Greg. I think those are the two main. I reached out to him because I didn't know what I was going to do after I graduated. I knew I didn't want to work in insurance-based care, or at least primarily insurance. And so I didn't know, and I knew I wanted to find a mentor, somebody that had been there where I wanted to go. I didn't want to just try and do it on my own. Because number one, I didn't trust my clinical skills. And number two, I didn't trust my business skills. So I was like, I think the quickest way to do this is going to be to find a mentor. So I reached out to Jeff and I reached out to Greg. I think there was other people I reached out to, but anyways, I think Greg might've said your name. And so I ended up saying, well, the heck, I'm going to reach out to Aaron. I know he has a clinic. And then it went from there. And at first I think I just said that I wanted to check out your clinic and look at it and come down for a couple weeks and see how it ran. And then I guess talks just progressed, and lucky enough, Aaron was looking for an employee. Yeah. What
was the first thing that I said to you? Not the very first thing, but do you remember that conversation?
No, I don't.
Okay. So you contacted me and you said, hey, this is what I remember. Basically, like, hey, I'm graduating in May. I can't take my boards in June. I've got all this free time that I can't do anything. Can I come and, check out your practice? Help you out, whatever. You were like, I've got 5 weeks. I want to work.
That's right.
And I said, well, go to the North Carolina website and tell me what you can do as a non, affiliated student. And
I couldn't do anything.
You couldn't do anything. Yeah. So here in North Carolina, like a tech can't do, pretty much can put hot packs and towels on people, can't really do much. And we don't have hot packs and towels. I got dust bunnies and toilets. And I was like, no, we're not doing that. So then I said, okay. So I got this, I was like, all right, my thing is like, I know the answer to that question, but I was like, well, let me see if Derek can come up with the answer. And you did. And then, and then what was the next thing do you remember?
You brought me over to your funnel.
Yeah. No. So the next thing was, well, yes, that was then. And I said, well, so in my mind, I was like, okay, well, what can I do with Derek for a week? And I said, well, you come down for a week, and you were like, I'll do whatever you need, I'll like pay for an internship or whatever, like I really want, you were hungry to learn. And I was like, all right, well, we can do that. But I said to you, look, I can do what you want, but I need a 6 month or a year commitment. And you were like, okay, we'll do that. And then I sent you to my hiring funnel.
Yeah.
I said, okay, if you can fill that out,
which you screwed up.
What'd you screw up? No, you don't give away the secrets.
Oh,
yeah.
Okay.
But it's tough. You didn't really screw up.
Well, I
but
put in the wrong
don't tell away the
email
secrets.
address,
Yeah.
and so it didn't go to the right area.
Yeah. So it was, So, but there were a few people that did that, and I was like, hey, but very few people who got past that point. So in tweaking my hiring funnel, I had to go through and like push people and nudge and say, hey, X, Y, and Z. Very few people went beyond that.
Yeah.
There were only 4 people that finished, out of 8 months of looking for a PT.
Yeah.
And, so I was looking for a PT, and it was like, okay, I need a PT. And I was like, okay, well, let's see if Derek wants to come in. So we set up an agreement that would be more of a residency, because you wanted a clinical and business mentorship, not just business, but also clinical. And we started in, what did we start in? May. And tell us about what did you do between, we kind of have hashed out an agreement in February and May to prepare.
Studied.
Yeah. And what else?
I studied for boards. And then I ended up going to some continuing ed courses. So I took the SFMA, I took number 1 and number 2, and then I took a myofascial release course. Yeah.
All before you came here and graduated. Yeah. Which is impressive. That was one of the things that sold me. I was like, he's already studying and showing that he really wants it, which is awesome. And you and what set you apart from a lot of other people as well, not just in applying for a job, which wasn't really there. You weren't really applying for a job, but it was that you said, I want to do this. And then you did it, or I said, hey, do this. And then you took action on those things. So tell us a little bit. I want you to go back to May when you first started. What did you expect? What were you expecting when you got here? Your role, or, life, or, anything about what we had talked about. What were you expecting?
I didn't know. I didn't know what to expect. I had seen your clinic online because you have the Welcome to LeBauer PT. So I had seen the clinic online. I had seen some of your, I knew that you marketed, because obviously you're out of network, and you market to me as a PT, like we're doing right here. You market, and so I knew that you had some systems and different things like that to find patients. Outside of that, I didn't know. I guess obviously I knew a little bit of your systems inside the treatment room because you had me take a couple courses.
Yeah.
But as far as exactly what to expect when I got out here, I wasn't sure. Yeah, I didn't know how it was going to work out between you and me, how it was going to work out between me treating patients on my own, or if you were going to be watching, or how all of that treatment was going to go. I wasn't sure.
Yeah. What was the hardest thing that you had to do that first few weeks?
Get my license. Which honestly I think ended up being a blessing in disguise, because I was able to sit and watch Aaron treat for, I think it was 2 weeks.
Yeah.
Might have been a little bit longer. 2 straight weeks being able to just sit there and treat, and not being able to put my hands on patients or anything, and watch how you treated everybody. And then I really think that was a blessing in disguise.
Yeah.
Really do.
What and a lot of my this show isn't about necessarily treatment techniques, but was there something about the way that I was treating patients, interacting with them, or something else that either you were surprised about or didn't expect, or just didn't learn about in school or hadn't experienced before?
So I think that's 2 different topics.
Well, yeah.
So let's talk not even treatment, but let's talk about how to talk up to a patient.
Yeah.
I would say was a big thing that definitely didn't learn in school, and I'm still learning now. It's going to take time. It's 5 months, a little over 5 months I've been here, and I'm still trying to grasp the whole entire, how do I present this to a patient where they're going to understand. And I don't want to say buy in, because there's getting them to buy in to treatment strategy, and then getting them to buy in because you're trying to sell them.
Right.
Getting them to buy into what they honestly need is still an ongoing process with me at this time. And I'd say that was a big part, that with those first 2 weeks outside of treatment, that was a big part, is how to talk to the patient.
Yeah. How to talk to them Are we talking about on the phone in the treatments, like during the treatment or eval?
Everything.
Or everything.
Yeah, everything.
Yeah, we were working on this week.
Yeah. Like I said, it's still an ongoing thing.
Yeah.
It's a lot of confidence and knowing what to say in the moment.
Right. It's something that I'm still working on too. So don't think that, I've got it easy. It's easy for me to watch you and Sarah do it and give you feedback, constructive feedback. But I'll do it and I'll be like, oh, I should have said, and it's really difficult because a lot of these things are, we're not selling a widget, like I can sell a Theracane all day long, but to sell like I can sell your service better than I can sell my own service. Because we're selling a personal interaction. And I think that's what's the biggest challenge is we're selling like a personal interaction that doesn't have like a tangible something. We've got a tangible result that the patient can achieve independent of our interaction and our time with them. So tell me about what happened after those first 2 weeks. You started treating patients, and then I was heading out of town for 2 weeks in June. Remember that? Mm-hmm. So what did you do between you got your license in there to make you comfortable, or maybe you weren't comfortable, to feel like you were prepared and ready to, kind of basically run the clinic within 2 months of starting here? Like what systems did we have in place? What things did you do? What did you learn that got you to that point?
Continuing to work. I think one of the best things also about this has been that I'm not busy enough to where it's go, treat. It's I'm busy, but at the same time, I have enough time to be able to continue to research and continuing to study and continue to look at, okay, this is the patient I'm treating. Where do I need to go with this? And really try and dive deep on my own while I'm on the clock.
Yeah.
But I would say that one of the bigger things when you left was confidence.
Mm-hmm.
I mean, a patient's not going to know, okay, this exercise isn't 100% correct.
Yeah.
Or his hand placement, that's not how it's supposed to be. Like, they
Right.
don't know.
Right.
And so I would say it's confidence. That's the big thing for that 2 weeks when you left.
Yeah.
It was just being confident with what I had.
Were you confident before I left, or was it after after that 2 weeks that you felt a bigger change?
I would say when you left, yeah.
Yeah.
Because it's I'm the only one here, so I can't fall back on anything else.
Mm-hmm.
So it's a confidence, like I got it.
Yeah.
I can do it.
Yeah. Did anything happen while I was gone that you didn't tell me about?
Still not gonna tell you.
That's awesome. Yeah, that was like one of my big goals of the year was I want to go out of town and not close the clinic. In order to do that, I had to have someone come work here. And you were like, I can't get there till end of May. And I was like, can you get here earlier? Because I don't know if a month's going to be enough. And I didn't know basically until that week if I was going to be able to leave that Friday or Saturday.
Yeah.
I really I knew that once we started working together, but there was something about it was maybe a week or so ahead of time. I was like, okay, we can leave on Friday. I was like, we can go out of town Friday because, I can take that extra day off on the front end to go get to my brother's house a day early.
Mm-hmm.
Because we had a 2-day drive to Illinois. So, well, that's awesome. And then, so what have you learned working here with us that you didn't expect to learn?
That I didn't expect. I don't know. Like I said, it's not that I really expected a whole lot. I think it really just comes down to being able to talk to the patient.
Yeah.
And figuring out, it's not even necessarily selling them on anything. It's figuring out what they need in the moment.
Yeah.
And meeting them where they are, and their expectations.
What are the questions you ask patients to get that information?
What do you mean, like a number at the very beginning?
Yeah, at the very beginning, or in order to get that information from patients to find out where they are, to what their expectations are, where they want to go. What do you typically say to someone, to, uncover that? I mean, are you asking them what their date of birth is? And their,
No,
I mean,
no.
do we ask anyone?
We start with like what the problem is.
Yeah.
When they're having these issues, what they've done to seek out solutions, what their main concern is, what their number one goal, what do they want to get out of working with us. Just try and dive more into who that person is, and really trying to uncover and let them know that we actually care.
Mm-hmm.
I would say, because the more letting them open up, and the more you can get somebody to talk and open up about their story, the more comfortable they are, the more they're willing to tell. And then that helps with allowing you to know the true them and where they want to go.
Right. Do you feel like you are able to get to that like real answer quickly with people, or is it?
No.
Yeah.
No.
Is it because of your questions or them? Do you know?
Yeah, I think it's a little bit of both.
Yeah.
Sometimes I try and rush through it a little bit too much, because especially in that first visit, where sometimes I wish I had an hour and a half to sit there and like talk with them, but I want to be able to put my hands on them and give them something that they could do at home to immediately start seeing something that like they feel better, or they see something, some sort of change in that first visit, where I wish that I could sit down and just chat with them a little bit longer, but unfortunately you just don't have time.
Yeah, but we do have more. Do we have more time than your experience as doing one of your clinical rotations, or?
Yeah. I mean, we're one-on-one. It's you definitely have more time. But sometimes, even if I had that hour and a half, I might say, "Dang, I wish I had 2 hours."
I wish I had 2 hours. Yeah, so, I can't get as much treatment in today as I want. And part of that to me is like I want to fix this. It's like I used to look at people and go, "Okay, I know exactly what's wrong with you. Like you just told me what's wrong. I know what to fix." But patients are like, "Well, why are you doing that?" And they don't understand. It's like I think part of it's the buy-in, but we have to have this almost slower pace to get people to understand we know what the problem is. I think that's the problem with medicine, is that you go in and it's not just about wanting the quick fix and medications, but physicians don't have time to talk to us about what the problems are. Mm-hmm. And I don't know, that makes me, what gets me frustrated, because I get all these patients come in to me and they're like, "Oh, my physician told me I had the worst X and that I'm never going to get better," and blah, blah, blah. And then like we have to talk to them. And then 2 treatments later, they're like, "Oh my God, I've never felt this good in my life." It's just like, well, and part of it's just talking, What's the most valuable skill that you feel like you've acquired in the last 5 months that you didn't have before?
Clinical. I would say clinical. Mm-hmm. Coming out of school, I didn't trust. No way did I feel like I could do one-on-one treatment. It would have been like shooting from the hip. Mm-hmm. I mean, I knew a little bit of hands-on, knew some, mobilization with movement stuff, a little bit of McKenzie, different things, but it was more like shooting from the hip as opposed to I know where I'm going with this. Like I have something objective to look at and know what I need to do.
Do you feel like you should have felt that way after school?
Yeah, definitely.
Yeah. And was this like a factor of your clinical experience type of thing?
And the other thing, and with clinical experiences, I said to every CI, outpatient CI that I had, I want to learn more manual skills. I would say I didn't learn much. Yeah. Much hands-on, even when I asked. And it wasn't necessarily because they didn't want to give it to me. It was because they don't have it either. Right. They don't have time. They don't have time to spend and delegate, 45 minutes with a patient where they can offer 45 minutes of hands-on if they need it. Yeah. So I would say, no, I didn't get it. And is it the school's fault? I don't know. Yeah. It's a system. I think it's a system. I mean, I look at my school and we did 2-3 hour labs on massage therapy, and no one wanted to be my partner the second lab because I was already a massage therapist and they were intimidated. And I was like, all right, well, I'll see y'all later. I think it's a waste of my time. All right. What, tell me a little bit about, I got this. This is a great question. Let me go back to this one. How much is too much to pay for physical therapy? That's a value-based question. So I would say if you can educate the patient on the value you can offer, which your back-end system does, and your email, or not your email, your website does, testimonials, if you can educate a patient on how much value you can offer them, because most people don't know what PT is, and there's a lot of PTs out there that can't tell you. At least I think that they can't tell you like what is PT. A lot of patients don't know what it is, and so without knowing what something is, well, how much value can you put to that? Sometimes a copay is too high.
Right.
So the more we can educate the patient on what value we can offer, the higher you can charge. Like the iPhone, $1,000 for an iPhone. That's more money than I don't give an iPhone that much value, but there's people that do.
Right. I was just looking at that website and I was like, oh, this looks so great. I wonder how much it would be to get. It was like $50 a month, and I was like,
nope,
that's a lot.
Nope. So how much is too much? I don't know an exact amount.
Yeah.
But I feel confident that if I was in a patient situation where I would have the assurity that I knew somebody could help me, then a couple grand is not too much.
Yeah. How much is too much to give someone their life back?
Yeah, I don't know if you can even put a dollar amount to that.
Yeah. Yeah. Like your friend, the guy that was had the TBI. Yeah. PTs gave him his life back.
Yeah.
Right?
Yeah.
That's invaluable. There's no dollar amount.
Yeah.
Right? So I think that's just this important distinction that I think is important, because we don't sell physical therapy. We sell like this transformation. We sell, giving someone their life back. And that's where a lot of people ask, like, how do we convince patients to pay for physical therapy? I mean, I think that's the answer. So on that note, tell me, like, when someone calls and they say, "Do you take my insurance?" What do you say, and how does that conversation usually go?
So I skip the question.
Yeah.
And I try and get, while I say it, who am I speaking with? Just try and skip over that question, because if I answer that question with no, we don't, or it's going to cost you $150 each session, they're going to automatically they don't see the value.
Right.
So I have to gather who that person is, what they're looking for. And just like you said, it's not physical therapy, it's the transformation. And if I can offer that transformation, offer the surety that I can get them to where they want to be, it's not the $150 this session. That's not what it is. It's the not being confident in the value that they're paying $150 for.
Yeah.
That it's going to get them to where they want.
Yeah.
Okay.
Yeah. Okay. You got it.
Okay.
Yeah. Test is over.
Okay.
But you see how that's important, right?
Yeah.
Because you didn't always answer that question that way.
No, I know. But the more I've been here, the more I've seen how with the certain patient that's done their education and looked at the website and looked at the emails and looked at the ebook, and they begin to be educated on what we can offer, the easier it is for us to get them in the clinic.
Yeah.
And the less work we have to do to get them in the front door. If somebody just calls us from, "Oh, you have great Google reviews," they're not coming in. Chances are they're not coming in.
Yeah.
They have to do a little bit more research to figure out who we are and figure out that we can get them to their goals.
Right.
I think on the phone, basically, we just set them up with the appointment and get a little bit more. But it really is, it works better if they're either referred from somebody that's been a past patient or somebody that they trust, or if they've done their research on us and really looked into us more, and then they give us a call.
Yeah. Yeah. That always leads me back. I mean, I agree with you. And that always leads me back to this question for me. It was like, why I got into PT from massage therapy is that I wanted to be, I wanted to get patients right when they started having problems, like on the acute phase. Yeah. And what I've realized is I'm still getting them, because it takes people months and years of pain to figure out, all right, I have to do something different and be willing to go outside of the norm. So I'm just like, what can we do to get those people? And then I'm like, it's just be an orthopedic surgeon, and not make money, because my idea wouldn't be to cut on everybody and inject everything. But maybe that's not what I would be taught. So I don't know.
Well, they don't put. I mean, it is like there's chronic pain isn't easy to treat.
Yeah.
And so it's once they've gone through other PT or other chiros, massage, personal trainer, and they're not getting relief, then they start to see value in $150 a session.
Yeah.
Like this hasn't worked for me. My copay, my $50 copay hasn't got me there. Now maybe if I'm paying $150, these guys would be able to help me.
Yeah.
So it makes you wonder if you charge $200. Some people might see more value in it, and
right.
It's just a thought.
I know. I just paid $224 to go get my teeth cleaned yesterday.
Is it worth it?
I think so. My teeth are clean, and hopefully I won't have I won't have more cavities. And they almost sold me on the new electric toothbrush that pushes the water through all the things, all this stuff. He's like, I was like, look, man, I brush my teeth twice a day and I floss every day. At least they didn't give me your gums are bleeding and you're a 5, you're a 4, you're a 3. But I didn't get any of that, so that's good. But I was just like, they're doing a great job. I mean, I don't have dental insurance. Not many people do. I mean, we'll get as a physical therapy profession get there someday where people are just like, okay, PT is out of pocket.
Yeah.
Because even if someone has a $3,000 deductible, you're not spending that much money here just for back or knee pain. I mean, 20 visits here, you're not going to get 20 visits here, you might get to 3,000, I think. But that's a lot of visits.
Yeah.
That's a ton.
Yeah, there's very few we see that much.
Yeah. So tell me, where do you feel now that you've been here for, what has it been, May? It's been 5 months, just about 5 months. When you started, what was your idea? Okay, this is what I'm going to do when I graduate or when I finish this. And now, and is there anything changed between now and when you started about where you see yourself in a year from now?
Location.
Yeah.
I don't know where I'm going to live yet. Yeah. As far as I do know that I want to go somewhere that has, I can do dry needling. I can treat patients for, if they need to come 20 visits straight without having to go get a referral. So I need to go somewhere for that. But as far as clinic, I do like the idea here that we can do a lot more with less.
Yeah.
We don't have much here, and we get great results. It seems like a lot of people want the weightless treadmill or whatever.
Yeah.
And want all the equipment and I mean, with the right equipment, that's unnecessary. Unless you're treating, you have 6 therapists on at the clinic at any one time.
So where do you see yourself in 5 years right now?
I don't know yet. I mean, running my own out-of-network clinic somewhere.
Yeah.
But I still don't know. Yeah, I'm not sure. I want to get more into fitness. I would like to do a little bit more wellness.
Mm-hmm.
And be able to take patient from PT into more wellness where I have my hand in that. Yeah.
Like training, fitness.
Yeah. Not necessarily me training them, but I'm there and available, and my expertise are in there somewhere.
Right.
So I would like to do a little bit more wellness.
Do you see yourself having just solo practice with you, or do you see yourself having employees, other PTs, trainers?
In 5 years, I don't know about employees, but I'll definitely be collaborating with people.
Yeah.
Right on.
What's your ultimate goal for or your mission for wanting to be a physical therapist, start your own practice?
Helping 10 million people.
Helping 10 million people. That's a good start. You're gonna help me help 100.
Oh, yeah. It's 100.
That's 100 million.
Dang. Okay.
Yeah.
Ultimate goal is, I really don't know, because I think things are going to change the more I learn.
Yeah.
And I think the more patients I treat, the more I see what they need.
Mm-hmm.
The more I'll realize where I'm needed and what I'm good at too. And so as I continue to learn and continue to treat, I think that those doors will just open up as I find where I'm needed.
Yeah. All right. I'm just writing a.
No, that wasn't.
That's okay.
I
That was great. Yeah, no, I mean you don't have to know. You're 6 months out of school.
Yeah.
I mean, graduation was June and it's October, right? You don't have to know. I didn't know. Well, I knew PT school. Like I get out of. How old are you?
32.
Yeah, I didn't go to PT school till I was 34. I was 32. I was like, oh. I was 32. I wasn't living here in Greensboro.
Yeah.
You know, like whatever. Now I know. I want to touch on something else real quick, and almost not related, but something that's been going on in my life. And we've talked about this is, and this is a business thing as well, but it's investing, because we've talked about that some this summer. Just tell me, like, what have you? I think this is important because one, I'm learning about it more. I mean, not have I not learned about it, but I'm learning about it. But just kind of give me a little overview about what you've learned just from our few conversations about that, from the book I shared with you, and those things. Just why is it important?
That you need it.
Yeah.
That you definitely should be investing and looking towards the future. So right now I started putting 10% away.
Yeah.
Which
awesome.
Which is up to like $700 right now.
Yeah. But
I started putting 10% away so that I can start investing it. I don't know exactly what I want to do, but from what I did gather, and I don't know how in depth you want me to go with this, but investing in low cost index funds, a little bit of bonds, seem to be the two ways to go. But number one was low and cost index funds.
Yeah.
And they talk about how the worst thing you can do is be out of the market.
Yeah.
And the worst thing, that's not going to benefit is holding on to cash, because it devalues over time.
Or when the market goes down, selling everything, thinking you're going to save yourself from losing more.
Yeah.
Because the market always goes up.
Always comes back.
Historically, it always goes back up.
Yeah.
That's one thing, and that I've been doing and looking at. Okay, how much do I save, and where do I keep it? And one of the other ones is, so there's these low cost investment funds. It's basically mutual funds that try to beat the market, have more fees, and they're more managed, and you have tax. You don't make as much money or earn as much money, and they don't beat the market. But if you get the low cost, like S&P index fund, you're going to do okay.
Yeah.
And then, it's just about, like, if you're not in the market, if you're not in the game, if you don't take a shot, if you don't try, you don't stick your neck out there. I mean, that's the big thing that I think it kind of parallels cash-based PT, or what I did and what you're doing, is if you don't even try, it's never going to be successful. You got to have something, skin in the game. It's you got to have chips on the table, your car, or whatever. You got to be in the play to be able to do it. And it's pretty impressive, some of the different numbers that when you run it. Okay, if you're not in the market, X, Y, and Z, you don't make as much money. And I think the big thing is looking at, okay, I've got a cash practice. Okay, I've now have an employee. Okay, what happens when I retire? Does practice keep running? Okay, great. Am I still earning money? If I'm a solo cash practice owner, I can't sell my business very well, and I got to have some money for retirement. But I think even if you only save like $20 a month, you can still, after 30 years of investing and compounding, you can have a ton of money for retirement.
Yeah.
I think that's the number one thing. And that's that piece that, I wanted to share with you this summer, because I was like, I am learning how important this is right now, because I'm 43 and my savings isn't as big as it should be, because when I was 24, I was racing bikes and spending as much money as I could to travel around the country. And I did that until I was 33 or something like that. So anyways, I just thought that was important for you to share, and thank you. It's that little bit that's going to make this huge difference in the long term. So if you guys are watching and listening, you have any questions, feel free to post them in the comments, and we'll get to them. Derek, what would be your number one piece of advice from what you know right now for someone who wants to start a cash practice?
Find a mentor.
Yeah.
Yeah, I would say that's it. Like, there's no reason to try and, I hate this saying, but it's true. Like, don't try and reinvent the wheel. If you can find somebody that already has a wheel, just see it, jump on it. And there's no reason to struggle. You can save yourself time, money, hurt, pain, and all that if you just learn from a mentor. And that could be said with anything. Yeah. Anything, any goals you have, like, just find somebody that's where you want to be and try and jump on that bandwagon.
That's awesome. That's really great. And I didn't coach him on that. I didn't coach you on a lot of this stuff. So, okay, if you guys are watching and you're interested in having a mentor, this is a great segue because I've got this CashPT Residency program. Derek finishes up next spring, and we need to have another person come on board. So that
somebody comes, so I can start my own clinic and leave, because Aaron's not going to let me leave.
I know, I won't let him leave. So if you're interested, what I want you to do is go to LeBauerConsulting.com/residency, and you're just going to enter your name and email and info so that I can contact you when I have the new application up, and you'll be one of the first people to know before I put it out to the public. And you should also, if you're joining us live right now, you should see a little image pop up, and you can click on the link there to register your interest. If you're interested in working here at LeBauer PT for the CashPT Residency, just click on or go to LeBauerConsulting.com/residency. All right, Derek, any final thoughts before we finish up?
No, I don't think so. It's been a great experience.
Yeah, awesome.
It's been good. And first clinical, then learning how to communicate with the patient, which I really think even through the next, and I feel fairly confident right now with everything, but I think that learning how to communicate is going to be an ongoing process, no matter what.
Yeah, it always is a tweak.
Yeah.
It's always like, what can I do better? And that's I think, to me, that's a sign of growth and greatness, that you're always kind of self-analyzing, what can I do and do it better? So, I commend you for that, because that's huge for you. You're just like, what can I do? How can I get better? How can I learn more? That's a big trait, and one of the main reasons you're here. Yeah, and your personality. Okay. If you guys have any questions, go ahead and put them in the chat. Otherwise, we're going to finish up in just a minute. If you are interested in joining us for the LeBauer PT CashPT Residency, go to LeBauerConsulting.com/residency. And I look forward to seeing you on the next time. This is the CashPT Lunch Hour. My name is Aaron LeBauer. I'm with Dr. Dr Nielsen. Thank you very much. See y'all next time.